Hello YouTube Nation, this is another video from Zenspa Carmel Mountain in San Diego. Today we're going to do extraction on acne skin. Part of the treatment facials at Zenspa, one of the things that we do, especially for the detox and acne facials, is extractions. And we do extractions purposely to keep the pores clean, open, and also to get rid of blackheads and whiteheads when we can get to them. And basically this process helps with pore reduction and overall texture of the skin. For clients that have acne, it's good to do extractions because it prevents later on getting acne scars and pigs because of lack of care. So when we do extractions, we try to get all the postulates out and give the skin the chance to heal and be smoother and better. Okay, so you can do extractions in several different ways. Most estheticians use a 2x2 to do extractions, and we do that here as well. And one of the things you have to make sure of is to keep the area clean when you do extractions. For instance, we're just doing that, and you see that other thing. We're using a 2x2. And depending on the client's level of comfort, we also use extractor tools such as this one's listed here. And these are all sterile implements that we use for extractions. And a good esthetician is able to do extraction without causing additional abrasion to the skin. Some of the postulates, some of the blackheads are too deep, you can't get to them, but some of them are very accessible with a tool. You have to keep the skin constantly moist during this process in order to prevent further abrasion to the skin. Also, you have to hold your implement at a 45-degree angle so that, and do it slowly. You could go a little deep, but be slow in order not to cause abrasion to the skin. When you do extractions, there are three kinds of secretions that you should expect to see, and you shouldn't be alarmed when you see this. You could see a white clear secretion, which is normally pus around the acne area or the postulate, and you can also see deep red secretion, which is infected blood around the postulate, or you can also see just pure red blood. With experience, you'll be able to tell the difference. However, do not be alarmed when you see the secretions, because you have to make sure all of these liquids are out before the area can heal itself. So do not be alarmed. You can use a septic to stop some of the bleeding, and after extracting an area, it's good to use the high frequency to to make sure that the area is sterilized and kill any bacteria around the area and to help the skin heal properly. So in doing extractions, you have to be careful when you see a liquid or a liquid that looks like blood. Do not be alarmed, because it's part of the process. We have completed the extraction on our client who has a lot of acne, and as you can see, the area where we had some bleeding initially has subsided, and actually the pore is beginning to close. What a client should expect after this treatment then is from a little bit of scabbing from the areas where we extracted, and that should flake out in a couple of days, giving her clearer skin. We encourage our clients who have acne to come in for a facial at least every 3 to 4 weeks, because the process of extraction has to be continued so that they don't end up with ice pick scars later on. The at-home care for this will be recommended by your esthetician. It's very important to follow the protocol accordingly.